Gamekeeper's thumb, also known as skier's thumb. The anatomy consists of the first proximal phalanx, the first metacarpal, the first metacarpophalangeal joint, and the ulnar collateral ligament of the thumb. The ulnar collateral ligament of the thumb connects the first proximal phalanx to the first metacarpal over the metacarpophalangeal joint on the medial side. If the UCL is injured, one of two outcomes could happen. The first outcome is a grade 1 or 2 sprain. The second outcome is a grade 3 sprain where the ligament is torn and brings surgery into play. Associated bony avulsion fractures are seen in 20 to 30% of all UCL ruptures. There are a few common mechanisms that led the injury to getting its name. It got skier's thumb because it's popular to fall down while holding the ski pole, which is used as a fulcrum to tear the UCL. The second one is the gamekeepers. That is from the good old days when a rabbit farmer was called a gamekeeper and would snap the rabbits' necks in order to kill and then eventually eat them. So the term gamekeeper's thumb is more of a chronic feeling, and skier's thumb is more of an acute. A couple more consist of falling on an abducted thumb, getting your thumb caught in a jersey, or just direct trauma like Drew Brees just recently did in week 2. Some signs and symptoms to look for. Pain at the base of the thumb in the web space between the thumb and the index finger, swelling of the thumb, inability to grasp or weakness of grasp between your thumb and index finger, tenderness to the touch along the index finger side of your thumb, blue or black discoloration of the skin over the thumb pain that worsens with movement in any or all directions. The abduction stress test. As you can see, the examiner is stabilizing the wrist and the first metacarpal with one hand, while the other is pushing the thumb in abduction. An easy way to determine whether there is a fracture involved, use ultrasound without the heat aspect. While going over the affected area, if the patient experiences pain, then there is a good chance that there's a fracture. A couple of predisposing factors could be skiing or having an occupation where hyperextension and hyperabduction of the thumb is frequent. Management and treatment. The key factor in deciding the treatment plan is whether the UCL injury is displaced or non-displaced. A displaced UCL complete tear cannot heal by itself and requires a surgical intervention to prevent permanent instability and degenerative changes of the MCP joint. Patients who have timely surgical repair have favorable outcomes. The patients with a delayed diagnosis have less favorable outcomes. A non-displaced tear is immobilized with a protective splint for 4 to 6 weeks. The MCP joint is fixed and the interphalangeal joint is free to move to prevent stiffness. Associated fractures, if not displaced, are also managed conservatively. Physical therapy can be applied to facilitate the recovery. Differential diagnosis. Gamekeeper's fracture, avulsion fracture, wrist fracture or dislocation, chronic instability of the first metacarpophalangeal joint. Immobilization consists of splints and thumb spikas. Referrals need to be made to an orthopedic specialist or a team physician if the thumb is hypermobile, swollen, and in pain. X-rays and MRIs will be taken to look at the ligament and the bone since avulsion fractures are common. Prevention techniques. A thumb spica tape job before activity, instruction and proper pull technique for skiing, avoidance of pole dragging and deep pole plants to try and reduce the risk of falling, and also just being aware to let go of the pole while falling. Mulligan would not be useful due to the already hypermobile joint.